After your IPA, that is physical examination, now you can go up and do the diagnostic tests for the respiratory function. One of the first diagnostic tests is bronchoscopy. When talk about bronchoscopy, that's a procedure that allows direct visualization. So you are able to see the tracheobronchial tree using the bronchoscope. So the instrument that is used is the bronchoscope. The procedure is bronchoscopy. So anywhere where you see a procedure, bronchoscopy, that ends with oscopy, the suffix scopy, that means visualization. So it allows you to visualize, and it will help you to identify abnormalities within the airways. Usually, it's used to inspect the trachea and the bronchi for tumors, for infection, for inflammation, or presence of foreign bodies. Can also be used to obtain a sample for biopsy, diagnose diseases like lung cancer and TB. So you are nursing actions which you need to do before, like having the patient sedated. So that means that you need to have the patient have no food or fluids within 6 to 12 hours before the procedure, getting an informed consent. I know we talked about informed consent in the morning. Then after the procedure, of course, part of the pre-procedure is what we said, the pre-operative nursing care. So explain the procedure, the informed consent, assess for allergies, keep the patient of nothing but oral. They want to talk about 6 to 12 hours, remove any dentures and glasses, giving the pre-medication, just like we said in the morning. Then after the procedure, still maintain the patient on nothing but oral, so no foods, no fluids, until such a time that the gag reflexes returns. And usually the gag reflex will return after about 1 to 2 hours after the procedure. Monitor the sputum and the respiratory status of the patient frequently, because again, in the process of doing that procedure, there could be that there has been irritation of the airway lining. So just monitor the sputum if there is any form of bleeding. With whole foods, respiratory distress can occur, so get to monitor the vital signs of your patient. Chest x-ray, which we are all familiar with, very common diagnostic procedure. It's an invasive radiographic examination. So it can produce the image of the lungs, the heart, the diaphragm, and the bones that surround it. Very common diagnostic test. Can help to detect lung infections like pneumonia and TB, also tumors, and also evaluate chronic lung diseases like the COPD, that is the chronic obstructive pulmonary disease, and such like. So prepare again your patient, remove any jewelry that the patient has before the procedure. Then we have pulmonary angiography, which again, which is an invasive procedure where now you visualize the pulmonary circulation. It helps to monitor the pulmonary circulation, so the arteries and the veins. So what happens? A radiopaque dye is injected into the pulmonary artery, and now the radiopaque dye is usually monitored now how it flows through the arteries and also through the veins. So usually it helps to detect where an emboli has formed. That is pulmonary embolism. I believe we know what Ebola is. And also another vascular abnormalities that involve now the blood vessels within within the lungs. So before procedure, check if the patient has allergies to iodine or radiopaque dyes, because now if the patient has allergies, then this procedure is contraindicated. It's not allowed. It should not be done. Evaluate for pulmonary hypertension with whole foods, fluids for 8 hours before the procedure. Get the informed consent, still a repetition of what we said. Then get to inform the patient some of the side effects of that dye, where they form the flushing, or there is flushing of the face, or a burning sensation in the throat after the dye is injected. But again, right after the procedure, usually we advise that patient is put on fluids and it flushes out those they die, and the one again gets back to normalcy. So it's important that you inform the patient of that side effect. After the procedure, monitor the neurovascular status of the patient, the vital signs, the cardiac rhythm, the oxygen saturation. Get to monitor that for the patient. Then monitor the insertion site for bleeding. Then encourage oral fluid intake. This will help to flush out that dye. So post-procedure, patients always advised to do oral fluids unless it's contraindicated. That helps to flush out that dye. And of course, tell the patient if they develop things like respiratory distress or cyanosis or chest pain or bleeding at the puncture site, they should be able to report immediately. The next procedure is sputum study or sputum examination, where now we do laboratory analysis of expectorated mucus from the lungs and also to the bronchi, from the bronchi, just to diagnose mostly respiratory infections. So this one helps to identify microorganisms or abnormal cells or presence of blood or pus and respiratory secretions. Usually this one now helps to identify the causative organism in respiratory infection. So the culture and sensitivity of this specimen, where you identify now the causative microorganism, and that helps to now identify the most effective antibiotics or the most effective course of treatment for your patient. Usually, your nursing action when doing a sputum study is that you need to make sure that this is collected very early in the morning. The sputum is collected, the specimen is collected very early in the morning before the patient eats anything or brushes their teeth. It's very, very important. So ensure that you have a proper container, that's a sterile container, and then let the patient rinse their mouth with plain water just before collection of the sputum, which will help to remove the oral debris and also food particles. Then now let the patient expectorate. Then as your patient expectorates, ensure that you are not collecting saliva. So the patient should cough deeply from the lungs so that now you have the correct specimen for testing. Then after the procedure, assist the patient again to rinse their mouth, perform oral hygiene. Then we have thoracentesis. So thoracentesis, where now needle is inserted or is utilized to remove now fluids from the pleural space, that area between the lungs and the chest wall. So it will, or it's used to obtain a sample of intrapleural fluid to determine the cause of an infection, or sometimes it can be used as a management procedure where you want to remove now fluid, air, or both, either for diagnostic purposes or for therapeutic purposes. So usually thoracentesis is done under local anesthesia. The patient has to be put on anesthesia before the procedure is done. So that's why it's important, before the procedure, there should be an informed consent that has been obtained. Then explain the procedure, position the patient for the procedure, remove any tight clothing, jewelry that may interfere with the procedure, that preoperative preparation that we mentioned. And this is a sterile procedure, so that means that the personnel doing it must make sure that they maintain a sterile field. Otherwise, you are going to infect the patient. After the procedure, position the patient on the unaffected side for at least 1 hour. So you point the patient in a way that they lie on the unaffected side for at least an hour. Then monitor the respiratory status of the patient, monitor the vital signs frequently, about 50 to 30 minutes for the first 1 hour. And then now you can now enhance that progressively. Monitor that puncture site for bleeding. Check for signs of complications like dyspnea, cyanosis, auscultate the breath sounds after the procedure, because patient can easily develop pneumothorax. We'll be talking about pneumothorax as we discuss the conditions. Then we have the pulmonary function tests, which you've done, I know, which help to measure the lung volume, the ventilation, the diffusing capacity, and we make use of a spirometer. Yeah, so basically, spirometry is now used to measure the lung volumes and the capacities, specifically the amount, that is the volume of air, and also the speed or the flow of air that can be inhaled and exhaled. So now it's very common used to assess lung function, monitor respiratory diseases like asthma, the COPD, and such like. So usually the spirometer can again be used for therapeutic purposes to prevent atelectasis postoperatively. That's why postoperatively we always encourage patients to ambulate. Why? Because you want to avoid atelectasis, that is lung collapse. Again, therapeutically, it can be used now to improve lung expansion and also ventilation. So I want to go into the specifics in terms of the pulmonary function test. I know you've done that. You can just go and review on that. Then we have arterial blood gas analysis, which assesses the arterial blood for tissue oxygenation, for ventilation, and also acid-base status. So it looks at the level of oxygenation within the tissues. And the arterial blood gas, which, like I've said, measures just the oxygen levels, oxygen saturation levels within the arterial blood. So can help you to assess respiratory, metabolic, and also the acid-base balance within the body. So pre-procedure, before the procedure, not the um, you know, assess, prepare the patient, position the patient, um, look at the oxygen status before doing the procedure, heparinize the syringe that will be used to sample the arterial blood sample. That will help to prevent coagulation. So you lace it with heparin, which helps now to prevent coagulation. After the procedure, apply pressure on the puncture site for at least 5 minutes. Assess the puncture site for bleeding. Maintain pressure dressing for about 30 minutes. Then monitor, circulation, that is distal, um, uh, to the puncture site, and see whether there is circulation. So you look at the color to monitor circulation. You just look at the color, the temperature, the pulse in the punctured limb, and see how it is. If there are any abnormal ABG results, then you need to have this reported for intervention. So very important that you take into consideration that after the procedure, you have to apply pressure or firm pressure for about 5 minutes or more, and that will help to prevent an hematoma. Then we have lung scan, which again make use of radioisotopes, helps to create an image of blood as it flows within the lungs. So usually used to evaluate blood flow, that's perfusion, and also airflow, that is ventilation within the lungs. And that can help you to detect things like pulmonary embolism. So, but before doing the procedure, note the patient's allergies to iodine, to seafoods or the opaque dyes, then because that will be contraindicated if the patient is allergic to that. Get an informed consent, remove all metallic objects from the patient before doing the procedure. Then we have the Mantox intradermal, skin test, or which you refer to as the skin test, which is used to basically detect allergic reactions or infections, more especially tuberculosis. So in most common, that's what we refer to as the tuberculin skin test or the Mantox test, usually used to detect the TB and antibodies. So what is done is that a small amount of an antigen is injected intradermally, and then it's observed for its hypersensitivity reaction. So it's usually used to detect either latent or active TB infection, and also assess immune response to Mycobacterium tuberculosis, and sometimes can be used just for respiratory allergen tests. So before doing the procedure, uh, document any dermatitis or rashes on the skin, because it's going to affect. If there are rashes or there is dermatitis on the skin, that should be documented. Document, check history for BCG vaccination, because that can also give you false positives. So you need to look at the history of the BCG vaccination. Is the patient vaccinated against BCG? You need to document that. Then choose the site of the test and note it in the patient's record. You need to choose a site, and mostly the site that is chosen is the site that is hairless, an hairless area, so that you are able to clearly monitor the site after the test. So once you've injected that Mantox intradermally at about 15 degrees angle, then just ask the patient not to massage that site, and let the patient leave that site to be dry, and let them avoid scratching that site. Then instruct the patient now to monitor that site within the next 48 to 72 hours. So patient stays for about 48 to 72 hours. Then assess the reaction on that site. Is there erythema that has formed, that is redness in that area? If it is, that should not be considered as a positive Mantox test. At least there should be a raised farm area within that site, and that should now be a positive Mantox test. So that's why it's important. Sometimes you can use a pen just to scribble or draw a circle around the site where you've done the injection, so that now you can be able to monitor that exact site. Then laryngoscopy, again, oscopy, that means visualization. In this case, now we are visualizing the larynx. So again, before the procedure, informed consent, withholding meals, explaining the procedure to the patient. After the procedure, monitoring the respiratory status of the patient, checking if there is presence of the gag reflex, because the gag reflex should return about 1 to 2 hours after the procedure. Then if the gag reflex has not returned, withhold foods and fluids until such a time that you are sure that the gag reflex has returned before the patient can resume taking foods, fluids. Then lung biopsy. When we talk about biopsy, we are getting a small amount of a tissue just for histologic evaluation. So can either be done through a surgical exposure, that's open biopsy, where now an invasive procedure is done to open the lungs and then get a sample of a tissue for biopsy, or can be done by endoscopy. So endoscopy, you visualize, but as part of visualizing, you are able to get a sample of lung tissue for histological analysis, more especially when you want to do analysis for diseases like lung cancer, the COPD, that is the chronic obstructive pulmonary disease. So again, your nursing actions are the preoperative nursing actions, withholding foods because the patient will be on anesthetic agents, getting informed consent after the procedure, monitoring the vital signs, respiratory status of the patient should be monitored for pneumothorax, for air embolism, for hemoptysis. We'll talk about these conditions, assessing the incision site for any bleeding.